Hello and welcome. This e-learning will demonstrate how to pre-register research encounters using the newly modified Research Pre-Reg Registration Conversation. This change has been made to streamline the process. Research encounters are either created under the patient's medical record number, or a new medical record number is generated with the following naming convention. Last name, PI, which stands for Principal Investigator, followed by the physician's name, followed by a space and the letter ZZ. First name, the first letter of the patient's first name, followed by the first letter of the patient's last name. When there is an appointment for research encounters that have radiology tests and/or procedures, you can locate them in the radiology scheduling system known as Centricity. The Centricity icon appears on the left of this screen. If the icon does not appear on your desktop, then you must use the following URL link to open Centricity: http://uhmc-ris/web/default.asp. PM Office opens with the Conversation section. Here, we will select Research Pre-Reg Registration Conversation. The Person Search window now appears. The first method used to search for a patient is by entering the patient's date of birth. Now we will enter the patient's date of birth. Next, we will click the Search button. In some cases, research patient encounters are stored on a different medical record number under a study name. As their actual date of birth is not used on these study medical record numbers, the suggested search criteria should be followed. Last name, PI, which stands for Principal Investigator, followed with the physician's name. All of the patients with the date of birth entered now appear. Here, we will scroll down. Next, we will select the desired patient. All of the patient's encounters now appear. Always ensure that the patient does not already have an encounter related to this visit. Here, we will click the Add Encounter button. The Organization dialog box now appears. There are two different organizations that can be used, either Stony Brook University Hospital or MART. This depends on the type of service the patient is receiving. Next, we will enter Stony Brook U. Now we will click the ellipsis button. Our facility, Stony Brook University Hospital, now appears. Here, we'll click the OK button. The name fields appear along the top portion of this banner. The patient's mailing address is located under the banner level. Additionally, the Patient Information tab no longer exists in this conversation. The Encounter tab, Guarantor tab, and Insurance Primary tabs are the only tabs that appear in the conversation and are mandatory tabs every time an encounter is created and/or modified. The asterisk on the tabs indicates that the tab needs to be reviewed. Please refer to the C2 Ambulatory Care Guide for further instruction for completing the below fields in the Encounter tab. Below is a screenshot of the pathway to view the C2 Ambulatory Care Guide. After selecting the Shares W drive, select Admitting, then Patient Access, then Policies and Procedures, then Section C Outpatient, then select the C2 Ambulatory Care Information Guide. The Patient Care Unit is used to document the place where the patient will receive services, such as a clinic or mod for outpatient. Now we will click the drop-down. Here we will scroll down. Next, we will select ARAD. Patient type is a subcategory of patient class and is based on the patient service and the patient location. It is a hybrid classification. Now we will click the drop-down. The research conversation has two options within this drop-down: pre-outpatient to complete a pre-registration, and research to complete a registration and/or arrive the patient. Next, we will select pre-outpatient. The medical service is used to indicate the department that is responsible for the care of the patient. Next, we will click the drop-down. Here, we will select research. The priority defaults and is hard-coded as elective, as these appointments are scheduled at the convenience of the patient. The reason for visit field is used to document the test or procedure for any outpatient encounters. Now we will enter MRI brain. The ordering physician is used to document the physician that ordered the test. Here we will click the search button. The provider selection dialog box appears. Here we will search for the ordering physician. It is best to search by the first 4 letters of the last name and the first letter of the first name, as this will produce a wider range of results. Now we will enter COYL in the last name field. Here we will enter P in the first name field. Next, we will click the search button. Take note, the position column must display P4 or referral provider. When the column displays external provider or must update, an email needs to be sent to patientaccessqa@stonybrookmedicine.edu to ensure the doctor's information is updated, and the doctor will then display as referral provider. Here we will click the OK button. The referring physician will auto-populate with the name that was entered in the ordering physician field. The principal investigator is a primary researcher for a grant project. Now we will click the search button to enter the principal investigator. The provider selection dialog box appears. Now we will search for the principal investigator. Here we will enter KERE in the last name field. Here we will enter R in the first name field. Now we will click the search button. Next we will click the OK button. The IRB field is used to document the International Review Board grant number that was issued as an approval for the specific research study. Here we will enter the IRB number as 123123. The estimated arrive date is used to document the date of the upcoming appointment. Next, we will enter October 2nd, 2017. The estimated arrive time is used to document the time of the upcoming appointment. Note, times are always documented in Cerner in military time. Next, we will enter 1100. Now that the Encounter tab is completed, next we will complete the Guarantor tab. Now we will select the Guarantor tab. In this conversation, the Guarantor tab now has less required fields, as shown here. The guarantor for this workflow is always documented as a principal investigator. The patient's relationship to guarantor field must always be documented as other in this conversation. If another selection is attempted to be made, the below dialog box will display. It states, the relationship must be other for research encounters. Here we will select the drop-down. Now we will select Other. The principal investigator is the primary researcher assigned to a research study. Here we will click the Principal Investigator button. The Person Search dialog box now opens. The principal investigator will be found using this dialog box. Now we will enter KERE in the last name field. Now we will enter R in the first name field. Next, we will click the search button. The principal investigator's name now displays multiple times in the search results window. Take note, Always select the option that has the Stony Brook University Hospital internal zip displayed in the address field, as this is required for proper billing purposes. In cases when the doctor's name is displayed without the SBUH internal zip in the address field, see your immediate supervisor as they can add the physician with the internal zip into the system. Here we will select the name with the SBUH internal zip in the address field. Next, we will click the OK button. The Guarantor tab is now complete and all of the required fields have populated with the principal investigator's information. Now we will select the Insurance Primary tab. The below dialog box will appear every time a pre-registration encounter is created. It states, the relationship must be other for research encounters. Here we will click OK. The patient's relationship to subscriber is always documented as other in the Research Pre-Reg Registration conversation. Now we will select the drop-down. Next, we will select Other. The Relationships dialog box appears. Cerner ties relationships together from the Guarantor tab to the Subscriber tab and vice versa. Because Rogers was selected in the Guarantor tab with the relationship of Other, when selecting Other in the Subscriber tab, it allows the information from the Guarantor tab to auto-populate in the Subscriber tab using this dialog box. Next, we will select Roger. Now we will click the OK button. The last name, first name, and address fields populate accordingly. Here we will click the Search for Health Plan button to enter the insurance plan used for research encounters. There are several methods used to locate the various insurance plans. For this workflow, it is best to search by the Plan Alias tab. The plan alias that should be used for all research encounters is R99. Next, we will enter R99. Now we will click the ellipsis button. The research insurance plan now appears. Here we will select the address. Next, we will click the OK button. The insurance fields populate accordingly. The policy number field auto-populates with the IRB number entered earlier in the Encounter tab. Now we will click Complete. The encounter number has now generated. Lastly, we will click the OK button. In summary, the Research Pre-Reg Register Patient conversation has been modified to streamline the process. There are 3 mandatory tabs: the Encounter tab, the Guarantor tab, and the Insurance Primary tab. The patient's relationship to Guarantor and Subscriber is always Other. When selecting the Principal Investigator, always select the option that has the SBUH internal zip in the address field. The plan alias that should be used for documenting the insurance plan in the Insurance Primary tab in Research Encounters is always R99. A special thank you from the Patient Access Department. See you at the next lesson.